So let's go for microbiology. Some of the important points which are asked in exam from the questions point of view in MRCS. First, everyone we know there is bacteria, the infections, bacteria, parasites, wounds, and antibiotics. These are the four major topics on which questions are asked. So bacteria are of basically gram positive. This is by on the basis of gram staining. So it has got positive and negative, two broad. Then depending upon round, spherical or rods, cocci are spherical and bacilli are rods. Now among cocci, the cocci means they are spherical or round. So if they are in clusters, they can be in clusters 1, 2, 3, 4. They are just, these are the clusters. So clusters are now you can see these are the clusters. Cocci are round, they are round. Now round in clusters, they become staphylococcus. And if they are in chains or pairs, 2 2, so they form chains or pairs. These are streptococcus. These are important: cluster, staph, chains, strepto or entro. The questions are around this: staph, strepto. These are about gram positive: strepto, staphylo and streptococci. Now coming to gram negative. Gram negative, again same, cocci and bacilli. Cocci means round spherical, Neisseria, moraxella. These are cocci. Keep it aside. Bacilli. Now bacilli has got, bacilli means they are in rods. They are rods. Now they are lactose fermenting, non-lactose fermenting. This is important. Commonly asked upon E. coli. We know all these names, but where we are to place it? Lactose. Just try to remember rod, lactose, fermenting E. coli and Klebsiella. Rods, lactose, E. coli. It is found in a urinary tract infection and all that. We remember this E. coli in UTI. So UTI, lactose. Just remember it is related with the lactose and it is rod-like. Non-lactose. So lactose, just try to remember it by the milk, and non-lactose, which is not milk, means it is green colored. Pseudomonas, Proteus stone, we get asteroid stones and all that. These are non-lactose fermenting rods. So rods, they are causing infection in urinary tract, they are causing infection in stones, they are causing infection Klebsiella, they are causing pseudomonas. Pseudomonas we know commonly catheterized patients in the ward, they get pseudomonas, burns, they get green color. So these are pseudomonas. Now, when we come with the question, what is positive or negative? These are negative. Positive are staph aureus and strepto. These are positive. Now it is negative. Gram staining is negative. Coming to anaerobes, which does not require. We are not going to remember everything. Clostridium, bacterides, actinomyces. These are anaerobes. So again, this is actinomyces is a bacilli, Clostridium is a bacilli, but they are positive. These are positive. So Clostridium perfringens, Clostridium tetani, diphtheria, anthrax, diphtheria, these are positive, but anaerobic. Poorly stained means this was gram staining, which are poorly stained: H. pylori and chlamydia. So the questions are commonly which are coming on this one, on staphylococcus. So what about this? Staph aureus is a very favorite question, and all the questions are around this. It is most common. So most of the questions are coming. It is gram positive. We are just read. And Staphylococcus aureus is clusters. They cause superficial wound infections or deep infections. Hmm? So inflammation is localized. What is the difference between Staph aureus and streptococci and staphylococci? This is localized because coagulase enzyme deposits fibrin. It has coagulase enzyme. So it deposits fibrin causing localized inflammation. This is the enzyme which causes deposits fibrin and it localize. So any abscesses, Staph aureus with exception. IV drug users, osteomyelitis. These are the deep septic arthritis, osteomyelitis. These are all questions are coming. Osteomyelitis, Staph aureus, septic arthritis, Staph aureus, breast abscess, lactational mastitis, Staph aureus, discitis, again question. So these are the questions. These are the questions on this. Let us see each question. Most common, one question. Localized inflammation, fibrin deposit, another question. Abscesses, a question. IV drug users, question. Osteomyelitis is caused by, a question. Septic arthritis, another question. Mastitis or breast abscess, question. Discitis, question. SSI, surgical site infection, patient operated, 2 days, 3 days, 4 days after that, Staph aureus. Early food poisoning, interesting question. 1 to 2 hours, within 2 hours, again question. Toxic shock syndrome, scarlet skin syndrome, these are very rare questions. What is the treatment? Antibiotic of choice is methicillin. But when there is methicillin resistance, MRSA, this is very again important question. Vancomycin or glycopeptide. This has come as a question. Glycopeptide. They not mentioned vancomycin. It is glycopeptide. VRSC means vancomycin resistant. If this is resistant to vancomycin, linozoid. This is a question. Second line. This is toxic shock syndrome. So many questions on MRSA. This is also interesting. The basic is transmission is by contact, hand to hand. So this is a question. Hand cleaning, hand washing. This is important step in the hospital wards and all that. It is transmitted from the hands. Hospital acquired. Inpatient hospitalized undergo surgery within last year. So whenever patient is admitted in the hospital and undergo surgery is last year. Community acquired, not hospitalized, undergo surgery within last year. It is more virulent. Guidelines for MRSA. So what all the persons working in the hospital, nasal swabs are taken and they are MRSA positive. First choice is Bactroban, mupirocin 2%. This has to be given first choice. 3 times a day for 5 days. If this is not responding with this, then neomycin or chlorhexidine. This is the thing. This question. Skin, if you get skin flora, skin is positive. This is nasal swab. Skin swab, chlorhexidine. This is a question. Same duration as nasal for 3 times a day for 5 days. If there is wound, mupirocin 2 months. Mupirocin, chlorhexidine for the skin. Every 8 hours means 3 times a day. This was about the carrier. Now person is having positive. Carrier is no symptoms, just carrying. Now patients who are admitted now having soft and skin tissue. What you will do? Antibiotic like doxycycline. If severe vancomycin is important dose. If not responding to vancomycin, ticomycin, it is basically for 7 days. This is the question. Bacteremia, severe vancomycin is the question. Not responding, linezolid. It is for longer period, 2 to 7 weeks. Arthritis, this is a question. Same method as vancomycin, linezolid, minimum 6 weeks. You are increasing the time. Bacteremia, infection in the blood, 2 to 4 weeks. Arthritis, joints, 6 weeks. Lungs, alternative linezolid, oral you can give, if not vancomycin, 2 weeks. Intracranial, CNS, linezolid oral, vancomycin. Eye infection, drops, gentamicin. Urinary tract infection, vancomycin. Most of the time, vancomycin. Coming to next organism, just now staph was limited to, it was limited. Now strepto has got widespread. The opposite of staph is now streptococci is gram positive, chains we have left. It is catalase negative, and this was coagulase enzyme depositing fibrin causing localized inflammation. Now this is coagulase negative. Coagulase is negative and catalase is also negative. Catalase. So coagulase negative, it causes widespread infection. So it has, depending upon the hemolysis, how it acts on the hemoglobin. So blood. So beta, alpha, non-hemolytic. Beta means complete hemolysis to the blood agar. Blood agar is there. It causes complete hemolysis. Then among beta hemolysis there is A and B. Then alpha hemolysis, this is beta, not B hemolysis, it is beta hemolysis. It has got A and B. And alpha hemolysis produces green color due to H2O2, which changes hemoglobin to meth hemoglobin. And there is non-hemolytic, which doesn't hemolyze. So beta hemolysis, among that there are two types, A and B. Group A beta hemolytic is Streptococcus pyogenes. The pus causing are group A. Most common is group A. Now alpha hemolytic, you remember this viridans, this is alpha, pneumonia, alpha hemolytic. And non-hemolytic is bovis, intestine, lungs and viridans. Now Streptococcus pyogenes, just now we read, it is group A beta hemolytic. So it has got this type of enzyme. So this is most commonly question, beta hemolytic group A streptococcus pyogenes. Name itself is telling pyogenes means it will cause extensive diffuse inflammation. Coagulase positive, the staphylococcus was limited. This is diffuse infection will cause like pharyngitis, sore throat. This is most commonly asked, sore throat. Pharyngeal infection, diffuse inflammation is because of. Now coming to cellulitis. So related diseases because of streptococcus pyogenes, they are widely spreading. Pharyngitis, sore throat. Pharyngitis and sore throat, most common. Cellulitis, impetigo, erypsals, because these are lymphangitis, pleural sepsis, necrotizing fasciitis, tonsillitis, scarlet fever. Treatment is penicillin for this. Streptococcus pyogenes. Now when you get some neonatal septicemia agalactica. Now regarding streptococci pneumoniae, this is streptococci pneumonia. You just think of lungs. So basically most common in all settings. Meningitis is related. When is meningitis, whenever you are getting meningitis, streptococci pneumonia is also taken. It is not limited to lungs. So otitis media, moraxilla is another cause. This is also, sometimes you get confused. How streptococcus pneumonia is otitis media? Sinusitis, upper respiratory tract infection going to the lungs. In treatment is cephalosporins and vancomycin. Bovis, this is for the infection after colonoscopy and surgery. Actinomyces, this is another question. These are questions. Bovis for colonoscopy. Otitis media is a question. Pneumonia, meningitis, this is also question to confuse. Meningitis, you think of pneumonia. Sinusitis, pneumonia. This is question on actinomyces. What is anaerobe? Anaerobe, facultative. Oral cavity The question is yellow sulfur granules. This one is the question. Penicillin is the treatment. This is yellow sulfur granules. Anthrax, this is the question. Anthrax, animal contact, pulmonary, hemorrhagic, mediastinus, gas gangrene. This is again question. Perforingens, this one is question. Also called as Welchi. So trauma is there and crepitus sensation. This one is the question. You feel a crepitus on the skin. This is picture. Crepitus. You see X-ray. This is gas forming, gas gangrene, perfringens. Just try to remember perfringens. And extremities trunk. Treatment is penicillin. Very high dose of penicillin is required. Metronidazole may be added. Clostridium perfringens. This is tetanus toxide. Nail prick. This is nail prick contaminated with the dust, rusty nail. Lockjaw, sardinious facies, back muscle, opisthotonus. Clostridium, just now we are at Clostridium perfringens, tetani, and difficile. All this is important. Clostridium difficile, very commonly asked. It forms a membrane called as pseudomembranous colitis. How it is diagnosed? It is not a stool culture, it is toxin. It is toxin which is detected in the stools. This is the diagnostic test. And how is the question? A person is taking treatment, use of antibiotics like amoxicillin, clindamycin, everything for any respiratory infection, admitted for 5 to 7 days, see for 10 to 4 days antibiotic use, getting diarrhea. Most common cause of hospital acquired diarrhea. So diarrhea, this is the question. Person getting diarrhea after taking antibiotic use for long term, maybe for any other cause, hospitalized, it is weak oral route, gets this type of membranes called as pseudomembrane on colonoscopy, then it is called as, this is candidiasis, this is yellow patches. So treatment is again metronidazole is the actual treatment, metronidazole or vancomycin plus metronidazole. This is one question. Clostridium diphtheria. What is that? There is pseudomembrane again on the cervical sore throat, non-healing as a grayish white membrane. This one is a question, and this is like this. Question is, you get a white membrane, air droplet infection, children common, that is Corynebacterium diphtheria. The questions coming on this Neisseria meningitis, site of entry is through nasopharynx, streptococci pneumoniae causing meningitis, entries through nasopharynx, extends from contagious all ages, and Neisseria meningitis. These are two commonly asked questions. H influenza, very common. Patient is unimmunized, child or adult, nasopharyngeal infection, local infection. So meningitis, H influenza meningitis. About enterobacteria, most common E. coli, Salmonella, Shigella toxin, Klebsiella proteus. So uropathogenic, UTI, this is question. 90% is E. coli. Enterotoxigenic, traveler's diarrhea, a person who has gone for traveling or developed toxigenic, dysentery like diarrhea. Enterohemorrhagic, blood diarrhea. This is enterohemorrhagic. This is all presenting as diarrhea. Enterotoxic, travelers, enteroinvasive, dysentery, associated with HUS in children. This is question. HUS, hemolytic uremic syndrome in children with E. coli. There is anemia, thrombocytopenia. Abdominal infections, appendicitis, this one is question. Appendicitis, you get E. coli. Diverticulitis, E. coli. Perineal abscess, E. coli. Treatment of diarrhea, this is supportive and azithromycin. Appendicitis, question, E. coli. Late, if there is early immediate E. coli, and late if there is bacteroids, other organisms also. Wound infection, bacteroid. This is interesting. Immediate wound food poisoning within 2 hours, 3 hours, Staph aureus is the question. Food handling, and if it is 1 day old, Clostridium perfringens. Clostridium perfringens, which is causing gas gangrene there. So it can also cause food poisoning. This is third question. A patient getting diarrhea and dysentery traveling outside, it is salmonella. 2 to 7 days Campylobacter jejuni. This is later because you get poultry, cattle, pigs, raw, travelers Campylobacter in 2 to 7 days. Treatment of food poisoning is rehydration, antibiotic azithromycin. Pneumonia, this is infection of the lungs. Either it is community or hospital. This is hospital acquired. Remember, 48 hours or more after admission into ventilator associated pneumonia. This is ventilator hospital acquired pneumonia. Ventilated acquired VAP pneumonia. It is called as VAP. So staph aureus is the question. Ventilator acquired. But if it is for longer period, this is another question. Pseudomonas. Most common streptococci pneumonia is community acquired. This is question. Moraxillan, Staph aureus, Streptococcus pneumoniae. And treatment is cephalosporin. Streptococcus pneumoniae most common. Overall Streptococcus pneumoniae. Pneumonia. This is another question regarding epiglottitis, quinsy or tonsillar. Infection most common is H. influenza type B. Non-infectious is trauma sarcoidosis. So person is third generation cephalovancomycin. This is epiglottitis. So H. influenza. Here is also thumbprint sign. Tripod stand, tripod position. Person is child is unable to take respiration, so he puts two hands behind front and takes the breathing. Tripod positioning. This word. Sore throat, dysphagia, H. influenza. This is another question. Acute otitis media in children. So it is H. influenza, ear infection. External Staph aureus. Question. External ear infection, Staph aureus. Internal ear, H. influenza, streptococci. So amoxicillin and all this has no treatment. No, this is the question. It has got no use of treatment. You have to give analgesics, topical steroids, cleanliness, oral antibiotics only if compromised. Acetic acid spray. These are the all. So regarding any prosthesis, wall or endovascular walls, orthopedic prosthesis, orthopedics, endovascular, and this was about the grafts, vein grafts. This is orthopedic graft. This is prosthetic walls. So very important thing is less than 2 months, 2 to 12 months, more than 12 months. All the walls, all the prosthesis, if it is less than 2 months, Staph aureus. If it is 2 to 12, just change to epidermis because it is common cell. Epidermis. It is a common cell. If it is more than 12, then strepto. Next comes the strepto. For all this orthopedic, strepto, endovascular, strepto, if it is more than 12. If it is less than 2, Staph aureus, common. Epidermis is a common cell. So within 2 to 12 months, prosthetic wall. So most of the time you get a streptococcus viridans in the cardiac walls, native walls. This is prosthetic walls. So this is native walls, infection in the common wall, streptococcus viridans. When you get prosthetic wall, then you have to think of aureus, epidermis, strepto. When it is native wall, cardiac wall, infection walls. This is important. Foreigner's gangrene. You have just read polymicrobial, E. coli, Klebsiella, and anaerobe bacteroids. Anaerobes are bacteroids. Polymicrobial. You say get the question. Systemic and all this. It is aggressive. This is foreigner's gangrene. Perineal necrotizing fasciitis, also called as perineal infection, necrotizing fasciitis, or so this is polymicrobial or bacteroids. Now this is another question about epididyma orchitis. Most commonly Neisseria gonorrhea and chlamydia in the sexually active. Non-sexually transmitted is E. coli. This is human bite, most commonly asked animal bite and human bite. Animal bite, this is coming as a question. Echinella, human ache, only one, that is Echinella. If it is there is not there, Staph aureus has to be in the option. And animal bite, cat scratch is there. Henseli, just try to remember this. Henseli is the name of cat. If it is cat scratch, and if there is cat bite, Pasteurella multisoda, hmm? Pasteurella multocida. So less than 1 month, consult specialist. More than 1 month, 18 years age. Co-amoxicillin. Everyone knows UTI is E. coli. Catheterized patient. This is another question. A patient is catheterized. One person is getting the 2-3 patients in the ward is getting pseudomonas. Symptomatic UTI. So treatment is trimethoprim, nitrofurantoin. Nitrofurantoin is contraindicated if GFR is less than 45 ml. Normally it is 125 ml. So if it is reduced, then you avoid nitrofurantoin. Trimethoprim is contraindicated in first trimester pregnancy. Diabetic foot. This is question. Staph aureus is common. Pyogens may be there. Deep infection, polymicrobial. This is question. Deep infection is polymicrobial. So now coming to parasitic infections, these are a person is having nematodes. It's nematode. Pruritus anis is the question. It is Enterobius vermicularis. It is the larva that is laying the eggs that is causing pain. Treatment is mebendazole. Pregnant patient, parental palmite. This is another question. Entomoeba histolytica traveling from India, Africa, has got food contaminated with cyst. There is diarrhea, abdominal pain, then liver abscess. This is all question. History of diarrhea traveling from this country and then coming. So treatment is metronidazole. Here is metronidazole. Here is mebendazole. For diarrhea, this is metronidazole. This is question. This is another question. Fasciculosa, person eating watercress getting infection with the fasciole. Lymphangia, this is lymphangia, increased inflammation and obstruction of the lymphatics, acute inflammatory often red area. Hepatitis again presents A with the jaundice. This present with jaundice, needle prick infection. This is question. Abdominal pain coming from traveling. This is question. Traveling from Asia, Africa. Hepatitis A infection. This is waterborne abdominal infection of the liver leading to vomiting and all that. This is RNA. Hepatitis C is RNA. This is question. B is DNA virus. This is question. B is DNA. C is RNA. Hepatitis A is traveling from the other countries. Classification of wounds. The questions are coming like this. Clean wound, contaminated wound. When the hollow organ is opened. Or little spillage. Organ opened, simple appendicectomy, this is question. Cholecystectomy is question. Percentage of infection is question. Then hernia, thyroid, breast, no hollow organ is opened. Major spillage is contaminated. Percentage of infection is 20. Dirty when there is perforation, diverticulitis, gangrene, more than 35% is the chance of infection. Coming to this page, this is the last important thing. What are the different antibiotics and where they are acting? So just try to remember 4 different important points. They want to act on the cells of the microorganism. Outermost is the cell wall, which is attacking the cell wall. Just try to remember penicillin was the first antibiotic attacking cell wall synthesis. Don't go inside first. First is the cell wall. So we know penicillin. Penicillins are, now among these penicillins there is lot of names are there, and cephalosporins. These are 2 important. First, second, third, fourth, fifth. No need to remember each name. Cephalosporins, all C. The names are coming from cephazolin, cephaloxime, cephalexin. These are all cephalosporins. That's why they are coming from the C. So all these are on the cell wall. C is cell wall. Cephalosporins, cell wall. So whatever you get cephalosporin, this is cell wall. P is penicillin. Is again on the cell wall. First is P, then there is cell wall. These are beta lactams. Now penicillin, ticarcillin, carbapenicillin, piperacillin, azoxystrobin, ampicillin, amoxicillin. These are all penicillins. Cillin, LLIN, ending with lin. These are penicillin. And Ceph, starting with CE, are cephalosporins. Now there is another group, carbapenems. Meropenem, imipenem, penem. Penem is again cell wall. So penicillin, cephalosporin, penem, monobactams, they are acting on the cell wall. So sometimes you get only glycopeptide. The name is glycopeptide. Remember vancomycin, vanco. This is for vanco. Methicillin resistant. So when there is penicillin resistance, Staph aureus, you think of vancomycin. So first you give methicillin resistance. So this is resistant to penicillin. So this is all acting on the cell wall. Then comes the proteins. Then comes the DNA. Then comes the folic acid. Then comes the RNA and all that. So first is cell wall. Among the cell wall is penicillin. Then from penicillin you give UPPPP or cillin, LLIN, means it is all a group of penicillins. Cephalosporin, cephaloxime, these are generations of cephalosporin. They are cell wall. Carbapenem, then beta lactam, sulfactam, all these are glycopeptide, no lactam. These are no beta lactam. Vancomycin, this is important. Coming to the next group, the second group is, this one is second group. This is important. Just try to remember one thing. These are acting on protein synthesis. Now from cell wall you have got inside the content. There is cell cytoplasm has got more protein. So they are attacking on the protein. So there are two types of ribosomes called as 30S and 50S. So 30 is small and 50 is more. So a common saying is that just try to remember this is protein synthesis, means you are earning something. You are trying to making a stock market, you buy at 30 and sell at 50, means you are getting some profit, you are getting some synthesis, you are getting something protein with you. So buy at 30S, what does it mean? At 30S, AT amino glycosides, tetracycline, ticarcillin, aminoglycoside, tetracycline, buy at. So this is buy at 30, AT, buy at 30 means amino tetra. Sell at 50, you want to sell, CELL, C is Clinda, E is erythro, L is linco, and this is L, lincosmides. So buy at, so B at, ATT, at, remember AT is amic acid and tetracycline, buy at. And sell at CELL, instead of cell, CELL is Clinda E. This is the protein profit, you are making a profit. So this is second group, protein synthesis. Then there is DNA and DNA damage, directly damaging DNA, metro is damaging DNA. RNA, mRNA, rifam, M is there, R is there, RNA is there, and rifampicin. Just remember R of RNA, R of rifampicin. Folic acid synthesis, folic acid synthesis, sulfonamides. So these are sulfomethazole, sulfonamides. DNA toprimoses, fluoroquinolones, ciprofloxacin. This is not with the cephalosporin. Ciproflox, norflox, leoflox. These are DNA topoisomerases. Folic acid, you have got folon. Now left is DNA, ciprofloxacin, all that. So this was in short about mechanism of action, organisms, pharmacology. So hope we remember this.